As you learned in Part 2 of the nursing process video, the care plan is the third step of the nursing process and is an essential part of a patient's care. Care plans provide a means for nurses to track a patient's progress and provide the appropriate treatment. Since several different caregivers may work with one patient, the care plan should be detailed enough for any caregiver to effectively continue care for the patient. The care plan consolidates the patient's present diagnosis, physical assessment, history, and medical records into a clear plan of action. The nursing care plan offers a holistic approach to patient care and continues to evolve until a patient is discharged from care. At Healthcare First, we understand the importance of the care planning process, so that's why we've designed our mobile app to efficiently and effectively assist you with documenting comprehensive, evidence-based care plans. By the conclusion of this video, you'll be able to recognize the benefits of a care plan, identify the components of a care plan, and see how the Healthcare First mobile app can help you quickly document and track your patient's care plans. The benefits of care planning include improved quality of care, continuity of care, patient participation, organized, continuous, and systematic delivery of care. And care plans hold nurses accountable for their patients' care. If you watched our nursing process video, then you already know the patient's nursing diagnosis is the basis of an effective care plan, and the care plan is then developed to resolve or improve the status of each diagnosis. The care plan primarily consists of three components: problems, goals, and interventions. Goals may be long-term or short-term. Interventions are the means by which goals are met and problems resolved or improved. The example that we used in the nursing process video was that one of a patient's problems due to pain may be immobilization. The goal was the patient will ambulate on stairs and level surfaces indoors. The intervention that might be used to meet that goal is the patient will move from their bed to a chair and walk up 8 to 10 steps twice per day. So again, problems are identified based on the assessment and diagnosis. Problems can have associated goals and/or interventions, and goals can have associated interventions. Now let's look at another example, but this time in the Healthcare First mobile application. One of the great features about the app is as you answer OASIS questions, applicable problems, goals, and interventions are being identified, so you can quickly add them to the care plan with a single tap. Here's how it works. Currently we're viewing a start of care assessment. Much of the assessment has already been completed, so for the sake of this example, let's jump to elimination status. And suppose this patient does require a urinary catheter. Now, of course, you could continue working through the assessment, but to demonstrate how the app identifies problems, goals, and interventions, let's jump over to the care plan screen. And then to generate a care plan based on the assessment, tap the Generate Care Plan button at the top. Note if medications are present in the patient's record, the medication management problem is automatically added to the care plan prior to tapping Generate. As you can see, several problems have been added based on the assessment documentation. Let's look at one specific example. Since the patient requires a catheter, there's one for urinary incontinence catheter. Now keep in mind, even though the application is suggesting these problems, it's still up to you as the nurse to use your critical thinking to determine if these problems are appropriate for this patient. You can easily delete a problem from the list by tapping the trash can icon to the right. Keep in mind, if there are any goals and interventions associated with the problem, those will be deleted as well. Also, if you delete any problems, interventions, or goals, and then tap Generate Care Plan again, say you went back and made changes to the assessment, then those previously deleted problems will be displayed again, but with a red asterisk. New problems from the update will also display with a red asterisk. So it's best practice not to delete anything from the care plan until you're certain you're done with the assessment. You can add additional problems by tapping on the half moon slide out on the right. You can search by keyword if needed. Then simply drag and drop the problem into the list. Let's look at the catheter problem. As you can see, 2 applicable goals have been added. Just like problems, you can remove a goal by tapping the trash can, which would also remove any associated interventions. Or tap the half moon slide out and add additional goals if needed. To maintain patient specificity for each goal, you can tap and hold for a moment. and a defined goal window will display so you can fill in the blanks. Also notice when you select a goal, the app will also display applicable interventions for that goal. In this case, there are 2. If there's a blank that needs to be filled in, just tap and hold until the text box displays, and then fill in the details. And just like problems and goals, if you need to remove an intervention, tap the trash can icon or use the half moon slide out to add additional interventions. And that's all there is to it. As you can see, with the mobile app, building a care plan is quick and intuitive. As you document the Oasis, the app is identifying problems, goals, and interventions that you can quickly add to the care plan. At any point during a patient's care, the problems, goals, and interventions can and should be updated when necessary. This way, the care plan continually evolves until a patient is discharged from care. Let's review. Care plans provide a means for nurses to track a patient's progress and provide the appropriate treatment. The nursing care plan offers a holistic approach to a patient's care and continues to evolve until a patient is discharged from care. The care plan primarily consists of problems, goals, and interventions, which can easily be documented and tracked in the Healthcare First mobile application. We're confident you're going to love using the Healthcare First mobile application because, like you, our focus is on patient care